afternoon, guys. It's Melissa, and I am back with Medical Monday. Today, I wanted to discuss what I feel like is a rare condition because it is widely misunderstood and oftentimes misdiagnosed. So, today, I want to discuss cerebrospinal fluid leaks as well as cranial spinal fluid leaks. Throughout this video, I will refer to cerebrospinal fluid as CSF, just for short. It's easier. But anyhow, cranial CSF leaks, in my opinion, are the most difficult to not only diagnose but treat because of the fact that our paranasal sinuses and our CSF are widely misunderstood. We're in the 21st century now, and researchers are just kind of understanding cerebrospinal fluid and what it does for our body and our brain and our spinal cord. So it's under-researched, it's underfunded, and patients suffer. I myself have had a spinal leak back in 2010 when I was diagnosed with IH. The second spinal tap they did to confirm diagnosis, they couldn't get into the proper lumbar region, and in turn I was poked about 8 times. So I was discharged from the hospital. I was on acetazolamide, which lowers the pressure of our brain, and I was on a lot of it. So I went home from the hospital, kept taking my acetazolamide, and I'm walking down the hall, and my mom is coming out of the bathroom, and I collapse. And I wake up to my son and my mom standing over the top of me, screaming, "What is going on? What is going on?" And obviously I had no clue. I didn't even know I had fainted. So I get up, they pick me up, and I try to walk. I faint again. So this happens about 3 or 4 times, and finally, and also my 3 and 6th cranial nerves were totally palsied, and I was basically cross-eyed. So my mom called 911, and the ambulance came and picked me up, took me down, and they did my 3rd spinal tap. And I had an opening pressure of 3. Mind you not, CSF fluid in the brain should be around anywhere from 8 to 10 in a small person like me, or 10 to 15 in a larger framed person. So clearly 3 was not enough to support my brain. I didn't have any nutrients bathing my brain, so my body couldn't function. So they drew a bunch of blood from me in the emergency room and set me up for what is called an epidural blood patch. And what they do is they take your blood and they inject it into your spinal column. So the blood will travel up the spinal column and hopefully find that leak and go into that little hole and seal itself up. So they did it. They put about 14 cc's of blood into my spine. I stayed in recovery for about an hour, discharged and sent home. I did pretty good. Still taking my acetazolamide. Everything was fine. Repeated lumbar punctures, and I was still losing my eyesight, so I had a referral to a neurosurgeon in San Francisco. I had a consultation and had my VP shunt placed. I've had nothing but problems. I've had 4 revisions with the shunt in about 8 years, including the placement, so that's 5 craniotomies. Within this time, I had a broken shunt, and I was being stubborn Melissa, refusing to go and have another surgery, so I just put it off. In turn, I complicated my situation and developed an ethmoid CSF leak. I had severely low pressure instead of high, which is just crazy for me because I'm always high and not low. So I went to my neurosurgeon, went through the gamut of tests. They detected the ethmoid CSF leak, patched me, sent home. I did fine. And fast forward now to January, and we're at the end of January. I have an appointment on the 30th in San Francisco to have another shunt function study. And if they can't aspirate the issue in my ventricle, then more than likely I will have to have another open craniotomy, which is fine because I don't want to complicate my situation further and end up having to have 2 surgeries. I would rather just have 1. So I am going to have my shunt checked and see what the issue is so I do not develop another ethmoid CSF leak, because it is miserable. You are bedridden. You cannot do anything but go to the bathroom. And even caring for yourself is difficult. I mean, for me, when I'm in severe low pressure, I can barely lift my head off the pillow without, number 1, vomiting, and number 2, fainting. So I require basically 24/7 care when I'm in a hypo state, and that's not fair to my family. So I just kind of want to spread the word and get it out there that, patients don't need to suffer anymore. If we can all unite together and spread the word, educate doctors, be advocates, go out there and be ambassadors for the CSF leak community, because, without sharing our stories and the complications we've experienced, there is no way for epidemiologists to further treatment modalities on our behalf and strengthen the continuity of care that we receive as patients. So please share my video, and thank you so much for watching.